respiratory viruses, including the one causing the current pandemic, are very sensitive to alcohol and hydrogen peroxide. Now, we know this from studies, but we also see it in action when you go to a dentist's office. Very likely, before they work on your mouth, they give you a solution to swoosh around in your mouth and to gargle with that is usually 1% hydrogen peroxide. And the idea is that most of the respiratory viruses are initially, at least, in the back of your mouth, so in the oropharynx and in your nose, fairly deep in your nose. That's the nasopharynx, and that's where we can reach them. So just like washing your hands, where you reduce what's there so you don't touch your mucous membranes and transfer the virus that way, here you kind of are able to decrease a lot of that viral load there, and that can have many advantages. So as a preventive strategy, besides the available pharmacologic preventive and treatment options that we have, I've been using for myself and for my family when we're traveling, or if I've been in contact with a patient that might have a upper or general respiratory virus, a mouthwash with about 20% of alcohol, something like Listerine Cool Mint, and all you really need is that inactive ingredient that's listed on it. That's about 20% of hydrogen peroxide, 20% of alcohol, and then we make a nasal spray. So this is just a normal, like a pump spray that I replace with 2/3 of clean drinking water and 1/3 of hydrogen peroxide at 3%. This is not medical advice. Before you do anything like this, of course, discuss with your primary care doctor. But this for me gives me about a 1% hydrogen peroxide nasal spray solution. So again, if I've been in clinic and I might have been in contact with someone, or if we're traveling where you just really can't avoid it, there's buses and planes and whatnot and airports. So you do about 3 sprays per nostril and slightly inhale as you do that slightly, to get it really up there. Tilt your head back, and then you take a shot of the mouthwash with 20% of alcohol, and you gargle with that. And so you gargle for about 30 to at least 30 seconds. Most studies have shown 30 to 40 seconds is ideal. And then, you spit out, and at that point also you can blow your nose. So again, this is a good preventive strategy if you've been exposed, because the way that the respiratory viruses get in is through mucous membranes, we know that. And so you have kind of an opportunity here early on to decrease the likelihood that a lot of that virus gets in. So that's just one thing. And then the other thing is, if you're sick with a respiratory virus, again, the nose and the throat, that's where a lot of it is sitting. Actually, I would say the majority of it is sitting and replicating in those areas, and we can reach them. And then you can do this strategy about 3 times a day. Again, that's what I'm doing. If you decide to do something like this, talk to your primary care doctor first. There might be some conditions you have where this is very irritating, or you shouldn't do it for other reasons. Again, just something that I'm doing. There have been studies showing that this is helpful. Some studies have been showing for specific viral respiratory illnesses that this shortens the duration of the illness significantly. And it's an easy thing to do, I think, So just like washing your hands, this oral nasopharyngeal hygiene, I think, is a very important step that has not been discussed very much. But I think it's a good thing that empowers us to say, look, we know we might have been in contact with this virus of some kind, or as a general precaution, doing that can be very, very helpful. Just like a good hand washing hygiene is very, very, very important. So again, before doing anything, talk to your primary care doctor. But we have these respiratory viruses, not just the current pandemic, but then there's flu season, and there's all these other year-round respiratory viruses that I think this is a good extra strategy to help us hopefully avoid getting sick, or if we're sick, we can hopefully decrease the severity of it by doing this as an additional measure to the other measures that are out there.